Hey guys, Chapter 14 vocabulary video for you. The first word is allergy. An allergy is actually a hypersensitive or exaggerated immune response to something that's otherwise relatively innocuous, like pollen or dust. And those things, those molecules that elicit an allergic reaction are known as allergens. So they're basically antigens that stimulate an allergic reaction. Atopy is any prolonged local allergic response. So things like hay fever, a runny nose, or itchy watery eyes, or redness, or welts. A bunch of people walking by the hallway listening to my vocab. That's atopy or atopic allergic reactions, which are different and much less dangerous than anaphylaxis, which is a systemic allergic reaction that is due to release of cytokines basically throughout the bloodstream, and it causes a massive system-wide allergic reaction that can be deadly quickly if not treated. Histamine is probably the most important cytokine, or the poster child cytokine, if you will, of the allergic reaction. It leads to the vasodilation or swelling of blood vessels that leads to redness and itchiness that are associated with a lot of allergic reactions or atopic responses. It also constricts the bronchioles, so things like asthma attacks, partly due to histamine. Another cytokine that's important in allergic reactions is leukotrienes. Leukotriene is actually kind of known as the anaphylactic cytokine. So it leads to sort of a slow, controlled, and gradual constriction of the bronchioles, which makes it hard to breathe. Histamine is very fast acting, whereas leukotriene is a little bit more gradually reacting. Prostaglandins are important cytokines involved in inflammation of all kinds, and they do a lot of things, but one of their claims to fame is they're responsible for pain. So when you take NSAIDs, over-the-counter non-steroidal anti-inflammatory drugs, you're taking them to inhibit the production of these guys, so your headache goes away. Asthma is well, actually, I'm going to do antihistamines next since we're on the topic of drugs that you might take over the counter. An antihistamine is a drug that you take to counteract the effects of histamine. So redness, welts, hives, itchiness, all of those things are a result of histamine, so antihistamines treat those symptoms. Asthma is a chronic condition that is due to autoimmunity or allergies, basically the immune cells irritating and causing chronic inflammation in the lungs, in the bronchioles, and specifically so that they constrict and it makes it very hard to get air in. They also can become inflamed and build up with mucus that narrows the lumen of the bronchioles, again making it hard to breathe, and particularly when you're exposed to an allergen, extreme constriction of the bronchioles that makes it very difficult to get oxygen. So that's asthma. Desensitization is a sort of radical treatment for allergies. So when you develop an allergy, you become sensitized. So somebody who's allergic to peanuts, the first time they eat peanuts, they are not allergic. The first time they eat peanuts, they become allergic. They become sensitized. So the first exposure is sensitization to an allergen, and then ever after that, you're allergic to it. And allergies can go away, and they can go away sometimes by controlled sort of small doses of an allergen can sort of train the immune system to become desensitized to it, to decide, okay, this thing is not actually dangerous. So desensitization is a controlled process of reducing an allergy or getting rid of an allergy. Rh factor. This is an immunogen or an antigen that's found on red blood cells. So you have ABO blood types, A, B, and O are antigens. There's also a family of Rh antigens. I think there's 47 different Rh antigens. It's the plus or minus, the positive or negative in your blood type. So I am B positive because I am positive for the Rh factor. So if you have any one of those 47 Rh factors, then you have a positive blood type. And if you don't have any of them, then you have a negative blood type. So positive blood types are definitely predominant. Negative blood types are not so common. It is a problem, though, during pregnancy for an Rh negative woman to be pregnant with an Rh positive child. Because basically she can become allergic to her child and attack it. So we'll talk more about that mechanism. But that's what Rh factor is. It's an antigen on red blood cells, very similar to the ABO antigens. Graft versus host disease and host rejection. These are two potential consequences of tissue transplantation. So in graft versus host disease, this is where the grafted tissue is actually attacking the host. And the only way it can do that is if the grafted tissue contained T cells. T cells are our body's cell attackers. So if you get like a bone marrow transplant and the T cells in the other person's bone marrow didn't like your cells, then they might attack you. So this is less common, I think, in somatic tissues, but more common in tissues that are transplanted that contain a lot of T cells, like bone marrow. Host rejection of graft is when the person who gets the donor tissue attacks that donated tissue. So if you were a recipient, the recipient's immune system attacks the new donated body part. So this happens a lot with organ transplants. In fact, people who get organ transplants have to take immune suppressing drugs for basically the rest of their life to prevent this from happening, to prevent their body's immune system as recognizing that new heart or new liver or new kidney as foreign, as non-self, and rejecting it. To prevent these types of reactions, the best type of graft to receive is an autograft, a graft from yourself. So you can do this with skin. If you have a severe burn on your arm, they could take skin from your butt or something and put it on your arm. So then you don't have any rejection issues because you're using self. Auto means self, so it's an autograft. An isograft is also a good option, but only for people who have twins, because this is from a genetically identical individual who is not yourself. Not everyone has a twin, though. So a lot of people, when they're getting grafted tissue or organ transplants, are relying on allografts, something donated from a family member or even a stranger, who is a close match but not an identical match for their MHC markers and blood type markers. A xenograft can be done on certain types of tissue. Xeno means strange or other, so a xenograft is actually from an animal. You can do heart valve replacements. You can do a graft with, I think, cow and pig heart valves work as substitutes. There's a couple of different types of tissues where you can actually substitute animal body parts. So that's a xenograft. An autoimmune disease literally means a disease where your immune system attacks itself or attacks yourself. So remember, the first step in lymphocyte development is clonal deletion. We're supposed to delete all of the T cells and B cells that recognize self. But if some of those don't get deleted, then we get immune cells that will actually start attacking our body. There's a lot of different autoimmune diseases that attack specific parts of the body. So multiple sclerosis is an autoimmune condition that targets neurons. Inflammatory bowel diseases are autoimmune conditions that target the colon or the small intestine. What's some other? Psoriasis, lupus. Type 1 diabetes targets the islet cells in the pancreas that produce insulin. So it results in killing off all the insulin-producing cells of the pancreas. Okay, that's enough about autoimmune diseases. Immunodeficiency is disease. So if an autoimmune disease is sort of like an overly sensitive, hyper-responsive immune system, immunodeficiency is the opposite. It's an immune system that's weakened, and it could be weak due to a genetic defect that somebody's born with. It could be weak due to drugs that they're taking, like if they're doing cancer chemotherapy, or if they're taking immunosuppressants because they've had a transplant and they're trying to avoid rejection. That can result in immunodeficiency. Oh, and of course, diseases like HIV can lead to AIDS, which is a type of acquired immunodeficiency. So some of the genetic or inborn immunodeficiencies that people can be born with. One is called agammaglobulinemia. I had to tilt the card to fit that one on there. Try it yourselves. Agammaglobulinemia. A means without, so this word literally means without gamma globulin, or IgG, in the blood. All right, so these are people who can't make antibodies, basically. Their B cells are defunct. It's a B cell deficiency, and so they lack the ability to produce antibodies. And it's in people with this condition that we can see really how important antibodies are to fighting infections, particularly bacterial and viral infections. So they are very prone to infections and have a hard time fighting them off. There's also T cell deficiencies that we'll talk about in lecture, but this is another mouthful, severe combined immunodeficiency, which is often just abbreviated as SCID. There's several forms of SCID, but they all involve both B and T cell deficiencies. So some genetic condition that results in a lack of both B cells and T cells. And these are sometimes popularized. People with this condition are sometimes referred to as a bubble boy or a bubble girl. And they really have no immune system, and they have to be hyper vigilant about their exposure because they have no adaptive immune response due to this severe combined immunodeficiency. All right, that was kind of a slow finish.